Now, tibia, which is Latin shinbone. Shin means it's lower part. It's the part from your knee and to till your ankle. So this is your shin bone. क्योंकि आपके पास and it's this border, that is the shin border or anterior border of the tibia. This is subcutaneous और आप बड़ी आराम से इसको feel कर सकते हो throughout your leg. So this is our tibia and it resembles our radius. Now the radius of our upper arm was lateral and this tibia is placed medial. तो इसकी क्या रीज़न है? Of course it's an embryonic reason. In our embryonic life आपके पास upper limb की रोटेशन होती थी laterally, right? जबकि lower limb रोटेट करता है medially. So that's why. लेकिन this bone, tibia, it is the homologous with the radius of the upper limb. So it's an important point. Let's talk about its side determination and anatomical position. The first important point is this कि ये जो राउंड ज़्यादा बड़ा हेड है दिस मस्ट बी सुपीरियर और इसके जो नीचे वाला पार्ट होगा दिस मस्ट बी इन्फीरियर. सो दैट्स द फर्स्ट पॉइंट. सेकंड पॉइंट इज दिस बॉर्डर. दिस इज योर एंटीरियर और शिन बॉर्डर जो आप फील कर सकते हो एंड इट्स वेरी शार्प एज यू कैन इजीली अप्रिशिएट. तो इस बॉर्डर को आपने एंटीरियरली प्लेस करना है. The third important point is this medial malleolus, right? This medial malleolus must be medially placed. और ये आपके पास जो इन medial side पे आपके पास जो ankle joint पे जो bump बन रहा होता है, right? This medial malleolus is making that bump. ठीक है. तो 3 points हो गए हमारे पास. This anterior border must be anteriorly. This part that is bigger, it must be placed superiorly, and this lower part must be placed inferiorly, and this medial malleolus must be placed medially. So in this way you will be able to know कि आपके पास right side की है या ये आपके पास left side की है. Now this bone is of right side. अगर फिर भी पता नहीं लग रहा तो आप posteriorly इसको move करो. Posteriorly you will see this line. ठीक है. This is your soleus line and this is very important. Soleal line, sorry, the soleal line, this is very important for the soleus muscle. ठीक है. तो इस तरीके से आप इसकी प्रॉपर साइड आइडेंटिफिकेशन कर सकते हो. सो दिस बोन इज ऑफ योर लोअर लिम्ब and it's of medial side. Let's start with its bony marking. Because it's a long bone, so we are going to, of course, divide it into three parts: upper part, the shaft, and the lower part. This upper part of the tibia, it has two condyles. Now, medial malleolus जहाँ पे था वहाँ पे medial size होगी तो this is your medial condyle और lateral side पे आपके पास lateral condyle होगा. Now अगर आप ऊपर से देखो तो medial condyle is much more larger क्योंकि आपके पास medial जो condyle था femur का it was the larger condyle than the lateral condyle, right? This medial condyle is going to articulate with the medial condyle of the femur. The lateral condyle is going to articulate with the lateral condyle of your femur. Now, these two are the condyles and we are saying this superiorly. अच्छा, दी condyles के दरमियान में ये area जो है, this is intercondylar area of tibia and it's a very important anatomical region because it provides attachment for our cruciate ligament and our menisci. Now let's talk about this. ये दोनों कंडाइल के दरमियान में जो रीजन है दिस इज योर इंटरकॉन्डाइलर एरिया. नाउ जब आप ऊपर से देख रहे होते हो तो इन दोनों कंडाइल के दरमियान वाला जो रीजन है द मिडिल पार्ट इज नैरो एंड इट इज रिज. ठीक है. ऊपर की तरफ उभरा हुआ है एज यू कैन इजीली अप्रिशिएट. एंड एंटीरियर भी देख लो पोस्टीरियर भी देख लो. अच्छा, ये तो उभरा हुआ है तो यहाँ पे आपको टू टुबरकल्स नजर आ रहे हैं. मीडियल साइड पे दिस इज योर मीडियल इंटरकॉन्डाइलर टुबरकल, right? Lateral side पे अगर lateral intercondylar tubercle, right? Is just like small mountains between flat area. तो ये दो tubercles हैं. अच्छा, जो your intercondylar area है, it is divided into two parts. ठीक है. There is an anterior part. ये anterior part पे तो this is your anterior intercondylar area and the posterior side पे posterior intercondylar area. And it's very important. Anterior intercondylar area में जो structures attach होते हैं, we have anterior horn of medial menisci. तो medial, this is your medial condyle, तो यहाँ पे medial मेनिस्काई लाई कर रहा होगा, तो यहाँ पर आपके पास वी विल हैव आवर इंटीरियर हॉर्न ऑफ मीडियल मेनिस्काई, the anterior intercondylar area में, and we have interior cruciate ligament as you can easily appreciate right over here. ठीक है, अच्छा, एंड वी लेटरल साइड पे आपके पास लैटरल मेनिस्काई भी आ रहा होगा, तो यहाँ पे आपके पास एंटीरियर हॉर्न ऑफ लैटरल मेनिस्काई होगा। अच्छा, जो आपके पास दूसरा है पोस्टीरियर इंटरकॉन्डाइलर एरिया, लाइक दिस वाला, ये पोस्टीरियर इंटरकॉन्डाइलर एरिया में आपके पास दोनों हॉर्न्स होंगे, मीडियल और लैटरल। पोस्टीरियर हॉर्न ऑफ लैटरल मेनिस्काई, पोस्टीरियर हॉर्न ऑफ मीडियल मेनिस्काई, और आपके पास पोस्टीरियर क्रूशिएट लिगामेंट होगा। So this area is very important, and you can easily appreciate this area is very rough. Why this area is rough? Because ligaments and menisci need a strong grip on the bone. Smooth surfaces are meant for articulate. This just remember this. Smooth surfaces are meant for articular cartilage, where rough surfaces are meant for fibrous attachment, right? And if this area is damaged, तो आपके पास नी जॉइंट में जो आपके पास इंटीरियर क्रूशिएट या पोस्टीरियर क्रूशिएट लिगामेंट है दैट आर वेरी इंपॉर्टेंट, उनकी इंजरी होने से आपके पास डिफरेंट साइंस देखने को मिलते हैं, दैट आर डिटेक्टेड विद द हेल्प ऑफ डिफरेंट टेस्ट, एंड वी आर गोइंग टू मेक अनदर वीडियो फॉर दैट, राइट? उसके लिए सो ये था आपके पास इंटरकॉन्डाइलर एरिया। नाउ लेट्स टॉक अबाउट द कॉन्डाइल। तो ये आपके पास कॉन्डाइलर रीजन था, राइट? आवर कॉन्डाइलर रीजन में हमारे पास तीन पार्ट्स में हमने इसको डिवाइड किया था। वी हैव आवर मीडियल कॉन्डाइल, लैटरल कॉन्डाइल एंड इंटरकॉन्डाइलर एरिया। इंटरकॉन्डाइलर एरिया के बारे में हमने पढ़ लिया। नाउ वी हैव गोइंग टू मूव टुवर्ड्स दिस मीडियल कॉन्डाइल। दिस मीडियल कॉन्डाइल इज गोइंग टू आर्टिकुलेट विद द मीडियल कॉन्डाइल ऑफ द फीमर टू मे इन द फीमर जॉइंट। द लैटरल कॉन्डाइल इज गोइंग टू आर्टिकुलेट विद द लैटरल कॉन्डाइल। नाउ दी बोथ कॉन्डाइल्स आपके पास अगर आप उसको सेंट्रली देखो तो दे बोथ आर समवट प्रोजेक्टेड अपवर्ड, और सेंटर वाला पार्ट जो है वो आपके पास कनकेव है दोनों पार्ट में, राइट? कनकेव। नाउ द मीडियल एंड द लैटरल मेनिस्काई आर गोइंग टू सिट राइट ओवर हियर, and it is going to cover all the articular surface except the middle, right? जो कि आपके पास concave area. Now this medial condyle area, medial condyle is much larger as compared to lateral condyle, and the medial condyle is more oval in shape. Lateral condyle, while is it's more circular. The medial condyle of the femur was the larger. तो आपके पास जो बड़ा होगा उसके लिए बड़ा condyle होगा, right? तो ये आपके पास मीडियल कॉन्डाइल। नाउ अगर आप इसको पोस्टीरियरली देखो देन देयर इज अ स्मॉल ग्रूव दैट इज इंपॉर्टेंट फॉर द इंसर्शन ऑफ द सेमी मेम्ब्रेनस टेंडन, राइट? दिस ग्रूव। नाउ अगर आप यहाँ पे लैटरल कॉन्डाइल के पोस्टीरो इंफीरियर देखो देन देयर इज अ फैसेट दैट इज a fibular facet, and this is important for the superior tibialofibular joint, right? It is going to articulate with your with our fibula. Now the anterior part of the of our tibia is also marked by two important tubercles. ये आपके पास जो anterior side पे है, this large rough triangular elevations, as you can see right over here. This is your tibial tuberosity, and it is important because it lie on the anterior aspect of the proximal tibia, and it is located just inferior to our tubular condyles. Now this is important for the attachment of our patellar ligament or patellar tendon, because the patellar tendon is attached to our tubular tuberosity. Now on the lateral side, this is interior view. So anterolaterally, there is another tubercle, that is Gerdy's tubercle. Now this Gerdy's tubercle is on the anterolateral aspect of the lateral condyle, and it is important for the because it's the side of the insertion of our iliotibial tract. That was the thickened band of fascia that receive fibers from tensor fasciae latae and gluteus maximus, right? So this is our Gerdy's tubercle. So that was all for the upper end of our tibia. Now let's talk about the shaft. The shaft of the tibia is has three borders and three surfaces. If I talk about its borders, then this is our anterior border. This is that is making the shin of our lower leg. Shin, that is very subcutaneous. Now it's S-shaped, as you can appreciate right over here. It starts right over here, here, and it is going to then meet with the medial malleolus. So this is almost S-shaped, right? So that's our anterior border, that is shaft and S shaped. It is convex, as you can see right over here. It is convex, whereas on the medial malleolus, this is our medial border of our tibia, right? This medial border, and it is round and it extends from the medial condyle to the posterior border of our medial malleolus, right? Medial malleolus. Now, then we have our introitius or the lateral border. This is our introitius or the lateral border, that is extending from our lateral condyle and it is moving downward, and then it is meeting with our medial, the lateral part of our lateral lower part of our tibia. So this is lateral border. Now it has three surfaces. Now the lateral surface, it lie between the anterior and the introitious border. That was our interior border and that was our introitious border. तो इन दोनों के दरम्यान में आपके पास क्या होगा? You will have our lateral surface. Now lateral surface in the upper 3/4 part, meaning so यहाँ से लेके यहाँ तक almost, in this upper 3/4 part, it is concave, as you can easily appreciate right over here in this diagram. It is concave, and the lower part is lower 1/4 part is directed forward. If I hold this bone right in the correct position, then you can see in the lower part it is directed forward. So that's our lateral surface. The medial surface, it lie between the anterior and the medial borders, right? This is our medial surface. The posterior surfaces lie between the medial and introitious border. So that was the introitious border, this is medial, and this is our posterior surface of our tibia. The posterior surface is recognized by this soleal line because there is a very important muscle here, soleus muscle. This soleal line just begins behind the fibular facet. This is what fibular facet is, and then it starts and then it's going to move right over here. And it's going to divide the posterior surface into two parts, the upper triangular area and the lower area. Then, as you can see behind this, inferior to this medial malleolus, we have this nutrient foramen. Now, this nutrient foramen is situated near the upper end of this ridge, right? And it is directed downward. Because this is directed downward, meaning to say the upper end of the tibia will be the growing end, right? So now the lower part of this, that is inferior to the soleus line, it is divided into two parts with the help of this vertical line. As you can see, this vertical ridge that is moving, this vertical ridge. Now this vertical ridge is dividing the area into our medial and lateral parts. So medial side back pass, this is our medial and this is our lateral part, right? तो ये था आपके पास shaft of our tibia. Now let's talk about the lower part of our tibia. The lower part has five surfaces. This is our anterior surface, right? The anterior surface of our lower part. This anterior surface, अगर मैं इसको सीधा ही पकड़ लेता हूँ, this anterior surface, upper part जो है वो smooth है, whereas the lower part is rough and it is grooved. Why it is grooved? Because several structures are going to pass across the front of the ankle, and they, in order to hold these structures in place, there is a retinaculum. This is extensor retinaculum, and the roughness provides the attachment of these fibrous fibers, right? So that's why the lower end is a rough area, and we are going to discuss this in our ankle joint as well. Medial surface, this is medial, it is smooth and it is subcutaneous मतलब कि आपके पास जो medial side में जो आपके पास जो bump नजर आता है, that is because of your inner ankle bone में आपके पास जो नजर आता है, that is your medial malleolus, right? Clinically it's very important क्योंकि आपके पास it is easily palpated and fractures are often very obvious, ठीक है, इस part में. This is medial surface. Now उसके बाद आपके पास lateral surface. This is our anterior थी, ये medial. This is our lateral surface. This lateral surface is very important because it has again another deep impression raises your fibular notch. This fibular notch is going to triangular depression, as you can see right over here. This is our fibular notch. This fibular notch is going to articulate with our fibula to make inferior tibiofibular joint, right? It's the superior and the inferior are basically a type of syndesmosis. Uh, which we are going to discuss in our joints. The inferior surface, as you can see right over here, this is our inferior surface. This inferior surface is the most important because it is going to form the roof of our ankle joint. It is smooth, it is covered with hyaline cartilage, right? And it is going to articulate with the trochlea of our talus, right? This lower end of our tibia. Then comes our posterior surface. तो ये अगर से ये medial surface थी, ये anterior surface थी, ये lateral surface थी, then this is our medial surface, posterior surface. This posterior surface is smaller, right, and it is give attachment to different ligaments and for passage of a different tendons. Medial malleolus की बात की जाए तो this is our medial malleolus. This medial malleolus is strong and it is downward projected from the medial side of the distal tibia, right? And it forms the, as I've told you, the inner ankle bone that you can easily feel. Now, the anterior part of the tibia is very subcutaneous, right? Subcutaneous है तो मतलब कि it can easily get fractured. For example, we have a transfer fracture boot that is called as the boot top fracture, or it is also called as the ski boot fracture. जब आप पहनते हो ना थोड़े से टाइट जूते जिससे आपका पाँव बाहर नहीं निकल सकता और आप यकदम आगे की तरफ अगर गिरो देन आपके पास देयर इज अ चांस कि आपके पास फ्रैक्चर हो सकता है, right? And this is a transverse fracture type. The inflammation of our tibial tuberosity, right? It is Osgood Schlatter disease, right? Why it occur? We basically remember our quadriceps muscles. These are attached to our quadriceps tendon. These tendon attached to our patella. Then patella, from there is a ligament, patellar ligament, and attached to our tibial tuberosity, right? Now, every time a person runs or jumps or kicks or climbs stairs, the quadriceps muscles contract, right, and pulls on the tibial tuberosity. Now, in children or in teenagers, the tibial tuberosity has not yet fully fused with the shaft of our tibia. So, in teenagers or in children that are involved in repeated pulling by this patellar ligament, this causes tiny injuries, right? That is micro trauma, inflammation, swelling, pain, and it is characterized by the pain just below the kneecap, tender swelling over the tibial tuberosity, pain while running or jumping, and pain improves. Uh, but this pain improves with rest.